Hello, it's Dr. Rhonda Johnson, and today is Thursday, January 11, 2024. Today, I'm talking about a measles outbreak in Philadelphia. First, I want to say it's 8 cases, and we're not talking about hundreds of people at this time on January 11th. So it started like a story. In early December, an infant who had been out of the country traveling with his family contracted measles. The baby was hospitalized with fever, and on the third day developed the classic rash of measles, a third day of hospitalization. That infant infected 3 other patients in adjacent rooms, none of whom were vaccinated. And then next outbreak was 5 children attending a daycare in Northeast Philly. They got measles after they were exposed to measles from one of the 3 children who violated the quarantine. In the city of Philadelphia Health Department staff, they're doing a lot of contact tracing, trying to contain this measles outbreak. 5 of the 8 required hospitalization. So a little bit more about measles. Measles is a highly contagious virus. You don't have to be directly exposed. The virus is contagious for 2 hours just in the air. One person who's an expert, Dr. Paul Offit, is quoted in a USA Today online newspaper as saying a person with the flu can infect about 2 to 3 people in a normal day, but a person with measles can infect about 18 people a day. Wow. So a measles infection is no joke, folks. It's serious. It can cause high fever, it can cause pneumonia, can cause respiratory failure, can cause inflammation of the brain, and even death. But all this can be prevented through immunization. Measles is a vaccine-preventable illness. The measles, mumps, rubella vaccine, the MMR, protects against 3 childhood viral infections: measles, mumps, and rubella. Now, I talked about quarantine, how the one child broke the quarantine. If someone you know have been exposed to measles, they are required to be in quarantine for 21 days post-exposure. Now, parents, think about your kids being out of school. You might have to miss work for 21 days. That's a long time. And many people don't have that much vacation time. And many people can't miss 21 days of work without financial hardship. So for whatever reason, you have been holding off immunizing your children against measles, please reconsider and make sure that they are vaccinated against measles. In outbreaks, children can be vaccinated as early as 6 months of age. And in some cases, they can give post-exposure immune globulin to help. Antibodies to help prevent infection. So that's my message today. I'll include some references on measles. Again, this is a preventable disease. We had eradicated measles in the United States, but it's back. Take care, folks, and be safe.